And now, United States Congressman Allen West has 10 minutes to present his views on health care.
Thank you so much, Sarah, and to my colleague as well, Ted. Great to be here, and thanks for each and every one of you for being here. What we handed out, I wrote an op-ed piece that was published in the Washington Times on the perspective on health care as well. You also see in the handout a list of the new taxes and also a chart, an organization chart for health care, and that's kind of where I want to have this discussion. You know, Ted and I agree. There is no doubt about it that we need to have health care reform in the United States of America, because we have a system where the price of health care is rising. But I guess the means by which we get there is where we do kind of differ. Now, I will tell you that I do agree that we need to have coverage for pre-existing conditions, because no insurance company should tell any American that they are not allowed to have health care in this country. I think that we need to make sure we take care of our seniors, to include the fact that that donut hole must stay closed and we don't have that gap for coverage for our seniors. And lastly, if a person wants to keep their child on their insurance coverage up to the age of 26, that is not a problem. That is something that they have decided to do. But the three things that I just mentioned, we could probably take care of in about 15 to 20 pages of legislation. It's the other 2,680 pages of the health care law that I think that we need to have a discussion about. First and foremost, when we look at the cost of this health care law, the United States of America, ladies and gentlemen, is $15.6 trillion in debt right now. By the end of the year, the United States of America would be $16 trillion in debt. Back in 2010, we were told that the health care law would cost somewhere about $940 to $945 billion. The CBO just came out with a recent rescoring of that said that this health care law is now going to cost the American people, the taxpayers, $1.76 trillion. There is a way that we can repair our health care system. But at this point in time, I don't think that that's the way to do it. And part of that, when you look at that page that I handed out, 11 to 18 different new taxes. In this critical time for us with our economic security and the way forward, right now is not the time to say that we're going to increase taxes on capital gains, dividends, or even with death taxes. And some of those things are included as part of the taxation for the Patient Protection and Affordable Care Act. Now, I kind of have to poke a little fun at one of those taxes, because if you want to talk about something that's pretty prejudiced, a tanning tax? I'm not going to a tanning booth. But that is somewhat the insidious nature of what we see coming out of the federal government. But why do we have to do that? Because this Patient Protection and Affordable Care Act, instead of bringing in doctors, instead of bringing in the medical professionals that really talk about how we prepare or how we repair this system, we're talking about 159 new government agencies and bureaucracies. You're talking about those taxes. You're talking about 16,000 new IRS agents. Of course, 3 weeks ago, there were $500 million that were given over to the IRS so they could hire the first 4,000 of those IRS agents. Why would we need to have 16,000 new IRS agents for health care law, unless it really is about just raising taxes on the American people? See, I agree that we have to repair the system, but I think that a top-down, government-driven type of system, and I'm not going to get into rhetoric or that type of thing, that's not what we need. We have grown the bureaucracy of education in Washington, D.C., but look at the standards of education in the United States of America. I don't want to see it go in that exact same direction. When you talk about what is happening on the ground with our doctors, a recent report came out that 13% of physicians are now not accepting Medicare patients. Another 17 are limiting the number of Medicare patients, and the figure rises to 31 of our doctors when it comes to primary care, because doctors are afraid of what happens with Medicare. And this Independent Payment Advisory Board does have a decision to make about pricing controls for Medicare and also for the reimbursement that goes to our doctors. And in order for Congress to be able to veto, supersede any one of those decisions that comes from the Independent Payment Advisory Board, it takes a 3/5 supermajority out of Senate to be able to do that. And if anyone knows about a 3/5 supermajority out of Senate, that's something that's very hard to do. And it's almost as if the decisions that will be coming out of the IPAB, that 15-member panel, will be somewhat hard to repeal. You know, when we look at the doctor shortage that we have, and also a doctor shortage that we have here, one of the critical things that when I go out and talk to doctors and medical professionals, they say the first point that we should start is some type of tort reform, some type of means of catastrophic litigation reform. And if you look at the 3 states that have done that in this country, Texas, Mississippi, and California, you have seen a decrease in the prices of health care in those areas. You look at, absolutely, we have many monopolies for our insurance companies state by state. We need to open up competition so that can help to drive down those costs for the individual. We have to put the individual back in charge of their health care and eliminate the opportunities of government to come down and be too involved. Because I think that's one of the problems that we see with this health care law in the direction that it is going. I think that we need to, once again, go back and look at a thing called health savings accounts and reinforce the use of health savings accounts, but instead in the Patient Protection Affordable Care Act, health savings accounts are taxed. That's a great way why the individual American citizen can be able to take care of their routine medical practices, and then we can combine it with the right type of insurance premiums and policies that can take care of those more catastrophic events. You know, I sit on the Small Business Committee, and one of the things that we had brought before us back in December, and Ted did talk about this, where we're reducing the amount of the insurance companies with this 80%, but it's called the medical loss ratio. And what's happening with the medical loss ratio, a lot of our small independent insurance agents are being driven out of business. And that's why you have seen since Inauguration Day of 2009, we have a 15% increase in health premiums, because we are driving away that competition. So I think we need to look at how we keep that competition there. We need to allow our small businesses to be able to pool together so they can compete as larger entities, so they can get the right type of health insurance coverage. But when you go out and talk to a lot of our small business owners, and all you have to do is drive through the district that I currently represent and look at those closed storefronts, and understand that a lot of people are shutting down because they cannot afford, and they are very concerned about the direction of the affordability of health insurance, especially when you take away those small independent insurance agents that they're used to working with that help them to keep those costs a lot lower. So what do I think we need to do with health insurance, health care reform in the United States of America? We need to come back to the table. We need to come back to the table and understand that economically the United States of America cannot afford $1.76 trillion over the next 10 years of costs. We cannot afford 159 new government agencies and bureaucracies or 16,000 new IRS agents. We need to go back and look at some of the very true and very simple free market solutions to our healthcare system. We do have good healthcare in the United States of America. We need to make sure that it is affordable and accessible to each and every American. And I'll close by saying this. When you read the Commerce Clause in the United States Constitution, which talks about regulating commerce, which at the time that the Constitution was written, the word commerce meant trade. But it was regulate commerce with foreign nations, among the several states, and with the Indian tribes. If the Supreme Court were to come back and say that the individual mandate is constitutional based upon the Commerce Clause, my fear is that the precedent has been established that the federal government now can create any type of commerce or trade relationship with the individual citizen in order to regulate them. And then we have to ask ourselves, what is next after health care insurance? I don't know what the Supreme Court is going to decide, but I know that we will be ready to provide the right type of free market options for the United States of America to ensure that we can continue to have a good health care system in the United States of America that is accessible and affordable. Thank you.